Call Debbie at I Will Advisors and schedule your free, no-obligation appointment to discuss all your Medicare options. 954-753-8080. 954-753-8080.
A healthier you is the first step toward a healthy baby. When planning a pregnancy, baby steps toward better health can deliver big results. Exercising regularly and eating a balanced diet will help you reach or maintain a healthy weight and increase the likelihood of a healthy baby. Taking a multivitamin containing folic acid every day helps prevent birth defects, and regular medical and dental checkups are especially important when planning for pregnancy. To learn more about taking your baby steps toward a healthy pregnancy, call Florida's Family Health Line at 1-800-451-2229.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to your Hometown Health Show, brought to you by Trilogy Home Healthcare, the industry leader with over 30 years of experience in providing home healthcare services such as skilled nursing, physical and occupational therapy, home health aides, and other specialized care to your homes throughout the state. Please tune in every other week as we bring you a range of good information from specialists in the field to help make you more informed and living healthy.
I can't hear you. Yolanda, Robin, can you hear Yolanda?
Now I hear you.
Okay, I don't hear you, Yolanda, no.
I hear you, Jennifer, not Yolanda.
Yeah, I don't hear you, Yolanda.
I can't hear.
No. I will go ahead and just talk a little bit about Trilogy, because that's normally what we do anyway. But I'm Jennifer Smith. I'm the Director of Marketing for Trilogy Home Health of Broward. And we have 10 offices in the state of Florida, ranging from Broward County all the way up to Jacksonville. And we offer your traditional home health, Medicare home health services such as skilled nursing, physical therapy, occupational therapy, speech therapy, but we also offer psych nursing, respiratory therapy. We offer dietary services, lymphedema services, and one of the best things you can get with Trilogy is our home health coordinators hold our patients from start of care through all the way through discharge. So when you have a loved one or an account has a patient that they want to refer, they have the luxury of just calling our home health coordinator, and that home health coordinator will manage and take care of every need of that patient from start to finish. And that's why we work with Robin here from Placement Counselors. So she has the luxury of just picking up the phone and calling one of our home health coordinators and knowing that she could have a neighbor or even one of her clients that she wants to refer, and knowing that from soup to nuts that client of hers is going to get taken care of from Trilogy. So
that's wonderful. That's wonderful. Can you hear me now?
I hear you.
So sorry about that. Some technical difficulties that happen sometimes when you're on a live show. Welcome again. You're listening to your Hometown Health Show. I'm Yolanda, your host for the evening. And we have Robin Rua of Placement Counselors. As you heard, Jennifer Smith did an introduction a little bit about what Trilogy does, right?
Yeah.
And how are you, Robin?
I'm doing fine, Yolanda. Thank you so much for having me today. And Jennifer, thanks for having me.
Of course. It's not my first rodeo, so I can just jump in and do whatever you need me to do.
So please, Robin, tell us a little bit about yourself. We're so pleased to have you as our guest this evening. Please continue.
Thank you. Yes, so I am a mom of 4 children. I have 3 grandchildren. Originally from Montreal, I moved here in 1983, worked in the handbag importing business and retail for many years back in the 80s and 90s. I was always very much focused on my children, my family, and so on. So after closing our company in the early 2000s, I was selling some advertising, doing fundraising, and so on, and met the owner of Placement Counselors, Umberto Fortuna. And he was looking for somebody to help him in his placement agency. So I really didn't know much about it, but I was willing to learn. And I basically shadowed him for 6 months, touring all the homes and hospitals, talking with case managers, social workers, and so on. I always had a passion for helping people and working with seniors. So I started working with him, and I've been with him since 2004. So that's basically how I started, a little bit about my background. And so I've been with him for 16 years.
Great. And that's it says a lot about a company when you've been with them for so long. Tell us a little bit more about Placement Counselors.
Yes. So Berto started this company back in 1999. He was a nursing home administrator and found the need to help families and patients who could no longer go home, to help them find the appropriate assisted living facility. He is a geriatric specialist. So we basically network with all the hospitals and nursing homes in the communities to explain what Placement Counselors does. We become the expert in that field and the link between the case manager and the family. Really, most important is to determine what kind of care the patient needs, the demographics, what their budget is. So we do all of that. We do a very, very thorough intake, working closely. Well, now with COVID, it's very difficult to get into the hospitals and nursing homes, but work very closely with the social workers to be able to determine what kind of level of care they need. So we become the extension of the healthcare provider.
All right. So if there's a listener that may be on the fence, can you tell them why choose a placement counselor for long-term placement for a loved one?
Okay. So, as I said before, it's very complicated. There are thousands and thousands of assisted living facilities. We get very involved with the care, first and foremost, the care level of the patient. So anybody can get on a computer or make some phone calls to look into assisted living communities. But if the patient, let's say, needs some nursing care, if they're diabetic, if they need some extended care level, well, just getting on a computer or making phone calls, you don't know what license that assisted living facility has. You don't know what their budgets are. What are they able to care for those that have extenuating circumstances? Are they just a basic license? Do they have a limited nursing license? You know, so we get more involved with all of that. We put it together based on care, demographics, budget. Perhaps it's a patient who is on long-term Medicaid. Well, not all the assisted living facilities accept the Medicaid. So we try to take the hassle out of it for the family member. We don't charge for our services. So by the time we do the intake, we already know pretty much which would be the top 3 or 4 or 5 communities that would work best for that particular patient. Also in assisted living facilities, you have the larger like hotel setting kind of communities. And then we have a lot of the small family care homes Well, maybe that particular patient is limited physically, and a lot of people think that they need a nursing home. Well, a nursing home is really if you need the skill of a nurse. If they can manage an assisted living, and some of these small 6-bed or the family care homes can accept them even if they're weight bearing, if they can take a couple of steps, then they would be best suited in a small place like that where they're still socially not alone in their own home. They can get the care that they need. If they need more continuum of care, then we often recommend the small family care home. So there's so many different things to put together when we're looking at an assisted living facility. If they're dementia or Alzheimer's, well, then we have to look for that kind of community. If they need a secured community. So there are just so many different variables that it's a lot easier for us as a placement agency to hold their hand, guide them through the process, and help them come up with the best solution, so they're not wasting, their time.
Honestly, Yolanda, and I hate to cut you off, Robin, but it's like going to a specialist. You've got a cardiac issue, you go to cardiologist. You have a kidney issue, you go to that specialist. There's so many factors involved in it, and people ask us, and yes, we're in healthcare, but for many things. You have a health ailment, and what do people do? They go to Google. It's so ridiculous. And if you were to Google assisted living, you're not going to find the right answer. And it's so foolish to do that. You should always go to the expert in every field. People are always looking for, even on Facebook, they're looking for recommendations for this, they're looking for recommendations on that. So you should always ask someone, what do you recommend for this? Because they always have had an experience in this, that, or the other thing, but you really should go to the experts, when it comes to important factors as someone caring for your loved one. People come to me for X, Y, and Z because I've worked in healthcare for too many years to say on live stream, but there's a reason for it.
Definitely. Let's continue this topic right after our first commercial break, and we'll be right back. Just stay tuned.
Trilogy was established in 2016 by industry experts with over 30 years in home healthcare operations spanning 30-plus counties throughout the state of Florida. With offices in Jacksonville, Port St. Lucie, West Palm Beach, we strive to provide the most optimal care to our patients in a fun, forward-thinking environment. Our focus is on personal relationships, whether with an employee, a patient, or an outside community, because we know that when people enjoy what they do, it becomes why they do it. Call Trilogy today at 954-689-6660 and ask for more information. In addition to offering the standard mix of services, PT, OT, speech, MSW, HHA, we also take great pride in being on the cutting edge and offering care and education to our licensed clinicians in other areas most agencies likely don't offer. Emotional and behavioral health with our psych nursing, biofeedback for bladder, incontinence and pelvic pain, chemotherapy, IV hydration, antibiotic and respiratory therapy. Call today at 954-689-6660. Trilogy Home Care.
Welcome back. You're listening and watching your Hometown Health Show. And I'm Yolanda, your host, and we were just talking about the importance of choosing a placement counselor. I would imagine that as a caregiver, trying to first start that process can be overwhelming. So it's so important to find the expert and get all that information because it's just too much. When I first started hosting this show, I didn't have hardly any information as far as I mean, my mother is the caregiver for my grandmother, so about that much is the information I had. So, yeah, it's a lot out there, a lot to deal with.
There are so many variables that we just don't know, and you can spend hours looking and not coming up with the right results.
So, Robin, can you tell our listeners what type of facilities you represent?
Yes, so multiple in the assisted living facilities, independent living. So independent living would be large communities that provide meals, housekeeping, activities, things like that, but don't include care. Secured memory care facilities as well. And those smaller family care homes, as I mentioned before, which they really are wonderful, the smaller ones, because they give a higher level of care. So those are basically the kinds of communities, and we cover the South Florida area, some national communities as well that we cover. So it really all depends on what the family's needs are, what they're looking for, but we cover them all.
So how has the pandemic affected the way you do your job?
Well, first and foremost, we can't see anybody face to face. Most of my job was always, marketing, going in to see the case managers and social workers and the doctors and the community centers, and as well evaluating the patients. So when typically as we get a call from a hospital, I would go in and do my own evaluation on the patient. Get a little better idea, and then recommend some assisted living facilities. And then they sometimes would go in, do their own evaluation to make sure. As I said, care is always first and foremost, and I always want to make sure whatever placement we're doing, that it's the right place. Well, we can't do any of that today. So we have to rely on the case manager or nurse or social worker at the institution, wherever they're coming from, or the family member. It's that, and families are hesitant to move their loved ones into assisted living now because they can't visit them. So everything is just completely upside down for me to kids are taking care of their parents. There's more home health agencies getting involved. I know that I've reached out to Trilogy, a few times, where and typically for that reason alone, that they did not want to move to an assisted living facility and they wanted continual home care. So it's really changed the face of everything. And even though they're saying now that assisted living can come in and family members can visit, it's with a lot of different ifs and what ifs, and so many restrictions that it's not just, they didn't just open the floodgates and everybody's going to visit now. It's going to be a long time.
Yeah, I can imagine.
But we're managing, we're doing what we have to do, and there are assisted living facilities that are taking.
It's very taxing on the families, as I'm sure you can imagine. It's just unknown territory, unknown charter territory. So it's difficult, but there are facilities who've done a lot of assisted living facilities I know in Broward that have done a great job with adding activities and keeping their residents as engaged as humanly possible.
Yes.
With keeping them socially distant and just doing absolutely everything they can to we've worked with a couple that have done pen pals with their seniors and even our families and patients, and they've done the drive-by parades and everything they can because it's such a unknown chartered territory, and they need to allow, or it's hard for me to take care of my kids in this situation, so I can't imagine taking care of our kids, trying to work and take care of our adult children. So I can't imagine what these, adult children are doing during this time.
Yeah, exactly. Getting stressed out.
Yeah.
So Robin, I understand there's also a 55 and up magazine. Can you tell our listeners about that?
Yes, it's called 55 Plus Magazine. This was something that Umberto created back in 2010. He initially did it, created this magazine to put a print magazine into the hands of some patients and the elderly who were not capable or computer literate in that respect. But we also made it a resource guide. So there's a lot of magazines out that have advertising for assisted living facilities, but he created something a little different. It's a bilingual magazine, and we have the resources alphabetically by county, and it includes things like different organizations like the Arthritis Foundation, mental health, VA, phone numbers that people can't actually access, but there's a guide for them to be able to get to them quickly. It is also online on a website. We offered a celebrity on the cover every issue, so that made it a little interesting, where we interviewed the celebrities. But we're still doing this magazine because we find it very helpful to the seniors and to the family members. We do the whole distribution to out in the community, in the hospitals and the nursing homes, so it's in the people's hands, it's in the community's hands.
It sounds wonderful. I definitely want to see this magazine.
Yeah, we can get you a copy. Absolutely.
Yeah,
that'd be wonderful. So we're getting to the end of our show, and I want to talk about how you work. How does placement counselors work with Trilogy Home Health Care? Do you have an example or scenario?
Yeah, good scenario. As I mentioned just before, quickly, a lot of people are not wanting to move into assisted living facilities now, so they need more home care. I don't do anything with home health. I don't know anything about home health. My specialty is placement. And so I would call Jennifer or Stephanie or whomever at Trilogy. I think they're a wonderful, wonderful agency, and they do so many modalities that a lot of others don't. So I would give them the referral if the patient still needs to be home or they're coming out of hospital, where they can do continuum of care for that patient until such time that they're ready to move to an assisted living facility, in which case they would get me back, call me back in, and I would recommend the assisted living facility, and then hopefully Trilogy can maintain that patient, that client. So we work really, really well together in that respect because I don't do home health. So
yeah. It has worked out. She'll get patients or clients out of the hospital, and she's called our other home health coordinators. I met Robin at an event before COVID even hit, and we were talking about children. I think I had known of you, but we were talking about my oldest in his Broward Center for Performing Arts event, and that's how we connected. And so that's how we've been able to work together. And then the client has come onto our service, and then once they're on our service, as we're seeing the decline, or if they get better and still need that assisted living, because unfortunately they're not always safe to be home. The clinical staff are actually encouraged or told to refer them back to the office. The office then contacts the rep. The rep is then the one that contacts Robin back for placement. So it's a nice little circle.
Yeah.
Right back.
Yeah.
So Robin, please tell us, how can we get a hold of you?
Yes, well, right now working remotely, my cell number is always the best. It's 954-303-2728. My office number is 954-965-2925. We're here to help you with whatever your needs are, anything to do with placement or any referral to Trilogy, whatever we can do.
Thank you so much to you both. Again, thanks for coming on this evening, and I hope you both have a great evening.
Thank you. Thank you so much. Thanks for having me.
Have a good night.
You too.
Trilogy Home Healthcare invites you to call our offices before making a decision about your home health and rehabilitative care. Different from other agencies, Trilogy offers specialized service that other agencies don't, providing exceptional care. That's who we are and what we do. Call us at 866-599-4959 or go to trilogyhomehealthcare.com.